Hello, everyone. We are going to get started. It's about 12:02. We may still be waiting on some people to join, but we figure we'll get going because we don't want to waste anyone's time. So welcome, everyone, to the American Lung Association's Community Connections presented by Novant Health and Wells Fargo. I'm your host, Carrie Beal, Health and Wellness Reporter at Spectrum News. A few housekeeping items before we begin. This webinar is being recorded and will be available after the session. Please submit questions for our panelists through the Q&A button. We will do our best to try to answer all of those at the end of the session. And we encourage everyone to complete the survey at the end as well. This will help guide us as we create future sessions. Today's discussion will focus on vaping, a national epidemic, particularly among our youth. In January, the American Lung Association's 20th annual State of Tobacco Control Report revealed significant progress in the work to end tobacco use. But products like e-cigarettes and other flavored tobacco products create concern for losing another generation to nicotine addiction. In 2021, more than 2 million high school and middle school students reported using e-cigarettes. In North Carolina, about 35% of high school students use e-cigarettes versus 11% nationwide. That's according to the nonprofit Tobacco Free Kids. Today's discussion will focus largely on the North Carolina youth. We will do a brief introduction of our speakers since you all received their full bios in the confirmation email. I want to start with North Carolina Attorney General Josh Stein from the North Carolina Department of Justice, and he is definitely here with us today. And Dr. Sasidharan Taravath, the Pediatric Neurologist from Novant Health. I see that he has joined us as well. And Luca Quinyard, he's a youth anti-vaping advocate. So we were going to start with Luca, but I don't think he is on yet. So we're going to give him some time to come on. I'm going to skip ahead to some of my questions for Dr. Taravath. I want to start with you asking about nicotine and vaping and the development of an adolescent brain. How can that really affect us as we as young kids get older? Oh, you're on mute. Make sure you unmute.
Okay, I unmuted.
Okay.
So I think there are two phases in life are very important. One, first 2 years of life, and then adolescence, where the brain goes through rapid changes. It's amazing. And I don't want to go into all the details about neuroanatomy, but here you can see this prefrontal cortex. This is very, very important. That's what makes us socially responsible, time management, executive decisions. And also, I just want to show one thing here, that this hippocampus, which is the seat of memory, and then here's amygdala, which is actually controls our emotions. So this is a very important time when all this organization is taking place in this brain. The circuits are made, and it works as a one good system. Can I show the next one, please? Here is what happens in nicotine. Nicotine, actually, there are nicotine receptors in the brain, which when you inhale a cigarette or any kind of nicotine, it acts on that receptors, opens up those channels, and obviously dopamine, which is a very important neurotransmitter, is released because dopamine makes us have the pleasure part of any experience. So it's a reward the brain gets. So he get used to it. And once you get chronic use, obviously you become addicted to nicotine. But we don't know what happens when you give a huge dose of nicotine. It does something because it works on the GABA receptors, which are inhibitory. And then once you open them up, I think that's what probably causes the seizures. The huge doses of nicotine probably interferes with that GABA receptors. And we also know that the ENDS, which is the electronic nicotine delivery systems, as we call them, gives one or two puffs, probably gives about 20 cigarettes worth of nicotine. So these kids will not only get these huge doses of nicotine, but they get it on a long-term basis. So two problems. One is the acute dosing, and second thing is the chronic addiction to nicotine. And they make a lot of changes in the brain. The circuits I showed you are affected by it. So it causes not only an immediate problem, and also a long-term problem.
Thank you so much. And I just have a follow-up question. It looks like Luca's still not here right now, but I've talked with him a lot about what he went through. He
Yes.
said when he was going through addiction to vaping, he would get very aggressive and very agitated. And I feel like that really correlates with what you're saying is going on in the brain. It's kind of
Yes.
taken over some of those messages there, those neurons.
Yeah, that's what I showed you, that
Mhm.
first picture, the prefrontal cortex and the hippocampus, the amygdala, they're all connected to our emotional well-being. So when, those circuits are disrupted, obviously disinhibition, aggression, lack of memory, and mood changes are inevitable. And also Lucas, I think, suffered from seizures when he took vaping. And that, what I've seen is that, and the literature says about, they've only reported about 35 patients with seizures, which I think it's a completely underestimation, because a lot of people get it and nobody goes into the history properly. But why do somebody get seizures? I don't think we understand it very well. But we know that the nicotine affects your brain. And is it only the vulnerable brains cause seizures? I don't know the answer to that, and nobody else does it either.
Well, thank you so much for, it kind of answered three questions in one right there. One other question though, the long-term effects. So if you start using it when you're a teenager, could it create a stronger addiction when you go into adulthood because you started so young?
Yes, because obviously, the dopamine is the hook actually, because that's probably makes it a pleasurable experience, the dopamine release in the brain. And the more dopamine you get, you're never satisfied. That's why people with addiction has to go back on higher doses to get the same amount of pleasure. So nicotine does the same thing as any other drug, working on the dopamine system, and chronically changes not only the chemistry, but the structure of these brain structures.
Okay. Thank you so much. And Sonia, she submitted some questions. It's really comparing cigarettes to vaping. So I know you're a neurologist. What can you say on that topic at all? How they're the same or different?
Yeah, the ends, as we call them now, the electronic nicotine delivery systems seem to give like 20 cigarettes worth of nicotine in one go. So you can imagine that. And now, not only that, they make it so attractive with different flavors and the marketing. So these kids are obviously drawn to it. And they're also given this false message that vaping is not harmful.
Yeah, and that is something Attorney General Josh Stein can touch on as well. That's who I'm going to introduce next. Josh Stein, in June 2021, you were the first Attorney General to hold e-cigarette maker Juul Labs accountable for marketing to kids, as Mr. Taravath was talking about. And the company agreed to a settlement requiring Juul to pay $40 million over the next 6 years. That money will fund programs to help people quit e-cigarettes, prevent e-cigarette addiction, and research on e-cigarettes. Attorney General, why is this such a landmark case, and what was the motivation behind the lawsuit?
Wonderful to be with you. Thank you so much for convening this panel. And I know that there are a lot of folks across the state from North Carolina on today, and it's a pleasure to be with you all. Well, my job as Attorney General is pretty basic, and it's to protect people. And that certainly includes protecting kids from nicotine dependence and the dangers of substance misuse. And when businesses are the cause of those problems, I come into play because we enforce the rules of the road. And if businesses aren't complying with the rules of the road, I will hold them accountable. So North Carolina was the first state in the country to take Juul to court, and we're the first state in the country to hold them accountable. Juul, of course, is the e-cigarette manufacturer. And what they did is they designed the product and then marketed the product and then sold the product in such a way as that it sparked a wildfire of youth vaping, not only here in North Carolina, but across the United States. So the product, as everyone knows, sort of looks like a USB drive, sleek, hip. Most parents didn't even know what it was if they saw it. They thought it was a USB drive. It used flavors, which were very appealing to kids. Things like creme brulee, mango, mint, even menthol. So it was appealing to use. And then they used social media in an exceptionally savvy way that unlike in the old days, when we saw an advertisement, it was either in a magazine, newspaper, or radio or TV. That was how we got information. Now they paid influencers to go on the coolest websites, whether it's Instagram or Snapchat or wherever the kids were hanging out online, and then show these young adults being super attractive, super hip, super cool. And that completely changed the dynamic of what was happening. And it was all the more tragic because over about a 20-year period, we had achieved an incredible public health accomplishment in this country. We drove teen tobacco use from about 30-some% in the late 1990s down to less than 5% in about 2015, 2016. And that was because of the Tobacco Master Settlement Agreement, a lot of changing social norms, no smoking in bars and restaurants. It was a really incredible accomplishment. Well, just like that, in a period of 1 or 2 years, all of those accomplishments evaporated like a puff of vapor. And it was because of Juul's practices. So we investigated them for about 1.5 years. We had a trial date, and right before the trial, Juul agreed to resolve the case. And in the process has fundamentally changed the way it does its business in order to protect and insulate people under the age of 21 from the product. And it's paying the state $40 million, which we will use to strengthen programs that help kids conquer their addiction to nicotine and hopefully never start using in the first place.
And adding on to that, a lot of attendees would like to know what the details of the settlement, like the implementation of it, the timing, and how it will prevent youth e-cigarette use or even help teens quit. What can you say on that topic?
Sure, I'll talk about the injunctive provisions before I get to the money side. And the injunctive provisions were the requirements that we made them agree to in terms of how they conduct their business. How are they going to change their marketing, and how are they going to change their sales in order to keep kids from getting their hands on the product and putting that vapor in their lungs and the nicotine in their brains. So they can do no marketing that appeals to anyone under the age of 21. They can't use the social media websites that kids frequent. They can't use influencer advertising. They can't do outdoor advertising near schools. They cannot sponsor sporting events or concerts, all of which there are a lot of youth interest in. They cannot make any claims comparing the health effects of Juul versus the health effects of combustible cigarettes and the marketing materials unless they get FDA approval to verify their claims. They cannot do any online sales to anyone not age verified by an independent age verification system. And they have to make sure that third-party online sales partners comply with the same. It used to be they had essentially non-existent age verification, and a kid could just buy the stuff online straight from the company. Most kids, however, get their hands on them at retail establishments, and they cannot do any retail sales to anyone who's not age verified using a barcode scanner. So they are now requiring all of their retailers to have a barcode scanner that verifies it is a legit ID, almost like what you have when you fly today, and the TSA verifies that the ID is legit. And this is actually going to help with sales of other products, whether it's alcohol or cigarettes or something that's non-Juul related, because the retailer will have it on site to help them verify the customers. All the products have to be behind the counters, so shoppers can't access them without a shop employee's assistance. There has to be a secret shopper program where they hire people 21, 22 years old and send them out to retailers all across the state to see if the retailers are in fact complying with the requirement to identify, card the kid. And if they're not, there are increasing levels of sanctions for retailers who are not in compliance. They can also not use any new flavors or nicotine content levels without FDA authorization. Now those were the two areas where I wanted more, but we couldn't get it because Juul, although it was the 800-pound gorilla, was just one player in the industry. And these are industry-wide issues, and we really need the FDA to take action, which I hope we'll talk about a bit later. In terms of the monetary piece, the $40 million, it's paid over 6 years in sort of decreasing levels, like 13 million, 8 million, 8 million, 6 million, 6 million, and then 2.5, I think, each of the last 2 years. And I actually wanted it spread out over a period of years because that money is going to go to help prevent kids from using it and to help kids who are currently addicted conquer that addiction. And so already the General Assembly has appropriated the first sum of money that we had secured. Juul has already paid the first $13 million, and the General Assembly appropriated those funds in consultation with our North Carolina Department of Health and Human Services tobacco branch. And so we are excited about the prevention and the treatment programs that are going to be funded through these resources.
And the enforcement, as you were saying, checking up, making sure that these stores are abiding. I want to pause now and actually introduce our youth advocate, Luca Quinyard. I see that you're here today. Luca, can you hear me?
I sure can.
Great. Thank you for joining us, Luca. I want to introduce you now so people can get a little bit background of your story, what you experienced. I'm sure a lot of parents here will have some questions for you and how to talk to their kids. So let's just start in general. I'll give a little background. You're from High Point, North Carolina, and were recovering from vaping addiction in your teens. And you started when you were just 14 years old. You started using Juul, and within a short period of time, you went from a straight A student to a student who was actually flunking out of school. So can you just recap a little bit your experience with vaping, how you got addicted, and what it was like for you?
Absolutely. For me, when I first started, I was 14 years old and I was really new to high school. It was my first Friday night football game, and it was introduced to me by some older classmates, and it was kind of something that was almost like peer pressure, but at the same time, it was something that did pique my interest, just for the fact, I guess, to fit in. But it wasn't, you do this or you don't do this, and there wouldn't be any consequences if I hadn't done it. So I definitely was interested in it just for the fact of wanting to fit in, having some better seats in the Friday night football game. It started out innocent, and very quickly I definitely started to use it more rapidly. I would say probably within the first month or two, I definitely became really addicted. I would go through about 4 pods every single day, which is an expensive habit to say the least. So I would start to sell my clothes, my personal belongings, my shoes, really anything I could find to afford that habit, because at 14, I wasn't working. I didn't have a job. I wasn't able to. And that was distracting. I would be distracted at school, in the classroom, outside of the classroom, class transitions throughout the halls. And then definitely when I got home, schoolwork was the least of my worries. So very quickly I started to fail school. And that led to behavioral issues too, because I would have a lot of conflict with family, friends, and teachers. And I would get in a lot of trouble. And later on down the road is when I started to have some health issues. I had an inflamed chest wall, and then pretty shortly afterwards, I had a grand mal seizure for 6 minutes. And that was during my sophomore year of high school.
That's a lot.
Absolutely.
I'm going to skip ahead to one question. You've worked a lot with Attorney General Josh Stein, and how does it make you feel knowing that you were helping represent him in some of these cases, trying to take down Juul, trying to, get them to, stand for what they have been doing and saying to our youth?
Absolutely. It's been an absolute pleasure being able to work with everybody. And I definitely have really appreciated the opportunity too, because I think there's no better feeling than being able to help people, especially locally, but especially on a state level. So I definitely really appreciate the opportunity, and I'm always open to working with everybody.
Thank you, Luca. And Josh Stein, I'm going to switch gears back to you. Why were you inspired by Luca's case?
It's very impressive whenever any young person can confront something that was a problem to them. You know, I'm sure Luca wasn't proud of how his life was going in his early high school years, but he was willing to face that straight on and then have the self-possession and confidence to speak up in front of others. I think that, yeah, there's a picture on the screen about him talking to an assembly of his peers. Very few high schoolers want to talk to the assembly of their peers. That's a very nerve-wracking thing.
Probably don't even know who they are.
They don't know who they are, but they're, you know, it's absolutely normal to be nervous in that situation. And then to do something where you're talking about something that you're not proud about what you had done, that you know a lot of them are doing, and they may judge you for saying what they're doing may be problematic for them, because it certainly was for Luca. Look, it just takes a lot of bravery. And I'm really proud of Luca. You'll see in the middle picture there, I give out awards every year to North Carolinians who make a difference in the communities that they live in, called a Dogwood Award. And I was really honored to give Luca one, because he represents exactly the kind of citizen who makes a difference in their community. And so I'm proud of Luca, proud of what he did, proud of what he is. Luca's story by no means is unique. About the same time I was reading about Luca's challenges, I had two separate buddies of mine, each of whom had boys who were ninth graders, same age as my daughter at that time. So I'd known them for years. And they separately told me their son's story that was so similar to Luca's. The kids, good grades, athletes, their grades plummeted. They had to change schools. They each needed to seek medical treatment because of their addiction to nicotine. So I was hearing these sort of anecdotes happening at about the same time that the Surgeon General and the FDA Commissioner were declaring there to be this teen epidemic. So I had both the anecdotal and empirical evidence that something very serious was going wrong. And that's what really kickstarted the investigation we did in 2018, 2019 into Juul. And so I thank Luca for helping to inspire our work, which I think is going to be transformative in terms of the way Juul operates, not only here in North Carolina, but across the country. But it also, I hope, sets exemplar for the entire industry, because there are other industry actors as well whom we have to get in line as well.
And I thought I should mention one picture here. Luca is an Eagle Scout, so that's why that picture is up there.
May I add something?
Yeah.
Because I think there are two problems. One is a public health problem of smoking, and addiction. And also there is a problem with the basic sciences to show that how this affects the brain. And if you look at a lot of these industries are traditionally shied away from both those efforts. They don't want any basic science to show that this is harmful. And also they don't want to do any kind of public health initiative that this is not good for our communities.
Thank you, Mr. Taravath. I'm going to go on to one more question for Mr. Stein. In November, you announced that you were suing Juul founders James Monsey and Adam Bowen, accusing them of personally participating in the company's marketing strategies to attract youth. So how is this different from the other lawsuit that you filed earlier in 2021?
Well, the initial lawsuit was against the company itself, and the $40 million we won is meaningful. But when you compare it to what the early investors and the founders, Mr. Monsey's and Bowen, took out of this company, it's just a drop in the bucket. And through the course of our investigation, I became convinced that the founders were actively involved in all of the strategic decisions that the company made in terms of the design, the flavors, the marketing, the sales practices, all of those things that I described at the beginning that sparked this youth epidemic. And so they need to be held accountable as well. And so I want them to have to pay. And that's why I'm taking them to court as well.
Thank you so much. This has been a great dialogue. We're going to open up the conversation to our viewers. I know we have a lot of questions to get to. If you have a question, you can submit it in the Q&A button. We'll do our best to try to get to all of these. Attorney General, I'll start with you again. Joyce and some others have several questions regarding that settlement. So Tracy asked, what is North Carolina doing to prevent these products from being marketed and sold to our teenagers and young adults? I know you've kind of tackled that one, but if there's anything else you can add to it.
So the settlement only deals with Juul. And for instance, I mentioned a number of the things that Juul can no longer do, what social media sites they can't use, they can't hire influencers. They've committed that they will not hire any model younger than the age of 35 in any of their advertising. And if you look at the early advertisers, they were all very attractive people in their early 20s. So we have come up with what I think are effective strategies to cabin the marketing and the attractiveness of this product to teenagers who aren't currently addicted and using it. I mentioned Juul is not the only player in the industry. I've got lawsuits against something like 8 other e-cigarette companies and have injunctions against all of those. The cases are ongoing. I'm investigating Puff Bar. I'm sure Luca has insight into what's sort of going on among his generation now, but I have heard from my kids that Juul is less cool than it used to be. And now kids are using Puff Bar, or they're using these tobacco pouches. I think they're called Zen. And so it's a bit of a game of whack-a-mole. And, you know, I'm going to keep whacking the moles, but we also need to come up with industry-wide protections. And that's where the FDA comes into play.
And this might be kind of along those lines as well. Susan asked, where are we on further restrictions on flavored e-juices to reduce the appeal to youth?
That requires the FDA to act. And so there's the new FDA commissioner, Robert Califf. He was just confirmed a week ago. I wrote him even before he was confirmed and urged him to have industry-wide protections on marketing and sales practices to kids, the use of youth-friendly flavors, fruit, mint, menthol, anything that appeals to kids. It should only be tobacco flavors, and to limit the amount of concentration of nicotine in these products, because it can accelerate a person's dependence. The doctor mentioned that 1 pod is essentially equivalent to 20 cigarettes. Well, Luca mentioned that he was consuming 4 pods a day, 80 cigarettes worth of nicotine a day. And that's because the vapor is very easy for teenage throats to consume and to inhale. And so you were getting nicotine at a greater concentration, deeper in your lungs, taking it throughout the day rather than with a cigarette. You can't do it in your bedroom because mom and dad will find out. You can't do it in your car because mom and dad will find out. You have to do it after school, before school. You can do it a couple of times during the day. You can't do it in the classroom. You can't do it in the bathroom at school. You can't do it in the car. You can't do it in your own room. And so these kids are getting such intense concentrations of nicotine that we really need to limit that as well. And when you look at the rest of the world, the EU and Israel and other countries, it's set at 3% nicotine level. In the US, it's like 5.8%. It's just much more concentrated product.
Yeah. And I think Monica has a great question. She's essentially asking, what's the laws regarding someone of age who goes out and buys vapes or cartridges or e-cigarettes and then sells them to a minor who's obviously not of age? Are there serious consequences for that?
It's a criminal law that they're violating. I mean, to sell a product or distribute a product that is unavailable to kids, sell it to somebody who's under the age 18, it is a misdemeanor. And it doesn't matter if it's a retailer or it's a 21-year-old who buys it and then resells it. So it's a crime.
Thank you so much, Attorney General. Next, we'll do some questions with Dr. Taravath. Beverly and Monica would like to know, what are the immediate effects of vaping and linked to long-range health concerns? Also, have there been any studies complete on the effects vaping has on the lungs and respiratory system? So I know, again, you're a neurologist, but anything you can answer on the long-range health concerns?
Yeah, I think they were looking at the harmful effects of nicotine on the lungs, because we know that from our experience with cigarette smoking, But I think the COVID kind of put a damper on that kind of research going on. So I still feel that, it cannot be good for your lungs, because if it's bad for your brains, it's equally bad for your lungs, because you're getting this, like the Attorney General said, that it's a huge dose in a very convenient form. You're inhaling it about 4 or 5 times a day. It has to be bad. And obviously it'll cause long-term lung damage and, and interfere with their ability to exercise, sports, and in the pure fact that it will impair oxygenation. And we need oxygen in our brain and our body.
Thank you so much. And Amy has another question. She said, what happened to vaping disease, which was covered a lot in 2019 prior to COVID? Then she asked, what lung changes occur with heavy vaping usage? I know this kind of goes into the last question as well, but anything you can say on that one?
I think, the problem was that, one, I told you that it wasn't studied very well because of the the COVID came and everything went sideways. But before that, there was some indication that it was causing chronic lung damage, like the cigarettes were doing. We don't know whether it's linked to cancer. Right now, I don't think we can answer that, because there has been very poor public health effort to look at these problems. I told you about the seizures. There were only 35 reported cases of seizure, 1.8 million users. It's impossible, because I myself have seen more than 4 or 5 kids who had seizures after vaping.
Yeah, you need money for studies, right? Jamie asks, are there any updates regarding vaping cessation covered by Medicare, Medicaid, or private insurance? So if you,
I think, you'll have to check your own private carrier, but there has been efforts to support addiction treatment for tobacco. Definitely there was. And in fact, most of the insurers are helping you with that, and they will take care of the cost. And vaping, I don't think it's any different. And I'm sure you can talk to them and find out for yourself.
it should be preventative care.
Yes, absolutely. It is. I think we should do it before they go start with this. Prevention is it's a crux of the problem here. And there's no point in closing the barn door after the horses run away. We need to do it before they start vaping.
Mhm.
And like, I think the biggest culprit is the social media and the social influencers and these industries who make a prey out of these children to start vaping.
Thank you so much, Dr. Taravath. Luca, I have a question for you. A lot of guests want to know about talking to their teens or students about vaping. Several listeners like Deb are concerned about students' access to vaping and their inability or unwillingness to see the harm it is causing. We like to be blind when we're teenagers. So as a young adult who is addicted to vapes, you can probably answer some of these important questions. Lisa wants to know, how does vaping affect high school students? And maybe you can answer this from both your academics and your social perspective of that.
I would definitely say that I don't want to speak for every high school student, so I can speak on how it affected me personally and what I observed. I would say that, from an academic standpoint, it really wasn't what I was focused on. I used to go to school, get my work done, go home, get my work done first thing. And then I'd have the rest of the night or the evening or weekend to enjoy myself. But instead, very quickly, my focus changed from in the classroom having to hide what I was doing so I wouldn't get in trouble. So that would distract from me doing my schoolwork. And then my focus when I got home was, how do I get more of this? And it would become the next morning and I have to go to school and none of my work is done. So that was definitely a distraction, just in general from academics. I think I could say the same to applying that to my social life. I was distracted in that fact. I wouldn't want to hang out with people just for the enjoyment of their presence. I think I would definitely hang out with them for what I could get from them and vice versa. So it was definitely just a huge distraction. Definitely derailed me from a lot of things.
Yeah, it changes your brain incentives. All right. Heather and Malini, they have a question. What is the best way to stop your teen from vaping? And how can parents help teens overcome a vaping addiction? So I think this would be great if you could talk about how you stopped, what really stopped you, and then, what advice you'd have for parents.
Absolutely. For me, ultimately, I was sent to an inpatient treatment center when I was 15. And this was my sophomore year of high school, and I was there for 40 days. And we could say that the treatment center is what really got me to quit, but ultimately it was definitely just the ability for me to sit down while I was there in that environment to say I want to stop. I think it was incredibly difficult after I got home, and I recognized how many people just were so unsupportive of me quitting and being sober. That made me want to be sober. I started to look at myself as how I valued myself and my friendships, and I decided that I wanted to value myself more than how little people valued me, and that's ultimately what got me to quit. So I think that what's really going to take it is something that we can't force anybody to do. Is we have to help them and encourage them just to take care of themselves, and it's their decision if they want to do it or not.
So any advice of what you'd say to parents to tell their kids if they know they're vaping?
I would say, as a parent, I think all you want to do for your kids is just fix everything right away when you see something's wrong. And it's incredibly hard not to just jump in and get it all done and figured out, especially with teenagers. So I think what ultimately would just need to be done is, definitely forming relationships with them and building trust with them so they can confide in you, but reassuring them that things are going to be all right and that you're not judging them. You don't love them any differently. Those are definitely the first steps. I think that don't always be punitive, try to understand what the situation is. Of course, still hold your ground as a parent, but I think ultimately what they need at that moment is somebody to counsel them rather than to reprimand them.
Okay. So kind of help them along
Mhm.
rather than just punish them.
Exactly.
One
And again,
additional,
every teen is different, like you said. Yeah.
sorry, an
Absolutely.
additional comment, in addition to having sort of that base of relationship that's love and trust that you hope can serve to help build the trust that the kid can then use to tackle whatever has led to the addiction. A lot of us don't have the skills or knowledge on how to actually help. Once a kid is saying, yes, I do want to quit, we don't necessarily know how to do that effectively. And I put in the chat a texting program that has been developed by the Truth Initiative, which is the former American Legacy Foundation, which was the public health foundation that came out of the Tobacco Master Settlement Agreement from the late 1990s. And so it's the truthinitiative.org/thisisquitting. And look, I don't know if you've seen it or anybody have used it, but it's a way for a young person to get a text in the vernacular of a young person to give them that encouragement when they're thinking about, like, I really want to hit, and you can say, I want to hit, and then they'll respond back and say, be strong and remember why you're doing this, and they'll give that kind of affirming communication that can really help somebody. And the traditional way of dealing with quitting has been sort of the 1-800 quit lines, which that worked in the old analog telephone world. But when you look at children will never call an 800 number and talk to a person. It's just, that is not how they operate. And so having a texting program is much more effective for that population. And there are currently some 250,000 young people who are engaged in that program right now, which is really remarkable when you look. I mean, it's about 5 million young people are using tobacco in one form or another. So I encourage folks to take a look at that. Luca, do you have any experience with it, or you've talked to people who've used it?
I've definitely talked to people who've used it. I was not using it for my personal use, but I signed up for it just because I was interested in, seeing what the messages were like and seeing how it all worked. It was definitely what I think would have been useful for me when I was getting clean. So I would definitely recommend it to everybody if they can get their hands on it.
Thanks.
And there's one question I think is interesting, Luca. This would be for you. You have your own personal story, but Elaine asked, have you heard others from other students who had addiction issues like you, and maybe what worked for them? Have you seen other things work for other people to help them quit?
Absolutely. It's different everywhere you go because every community has different support opportunities. So some people might have support groups, some people might have better counseling at their schools. So it really definitely just varies and depends. I think that what I found most interesting was how, well, not, I guess people replaced, but a lot of times when you're getting clean, a lot of your time is now more free because you're not using. So I definitely think that those healthy alternatives, I think that was really interesting to me to see how different they were. Some people enjoyed sports a lot more, or doing something more creative like art or music. So definitely just, I think it was really interesting to me to see how many different people took up new things as a healthy alternative, or just how many different things people enjoyed to do.
It's kind of like figuring out what you can get them to do that might help them over that hump, whether it be sports, you know, sometimes the treatment
Exactly.
center. Hopefully we can figure out some answers. Well, thank you, Luca, so much for talking and giving your personal story. I think that helps a lot of people. So before we conclude this session, I want to share important resources for parents, teens, educators, and healthcare workers. The American Lung Association is committed to helping educate, intervene, and prevent the use of tobacco and nicotine by the next generation. These resources can offer you the tools to not only talk to your kids about the dangers of tobacco, but to help them quit if they have already become addicted. Visit lung.org and click on the Quit Smoking drop-down tab, then e-cigarettes and vaping. There you will find information on our Vape-Free Schools initiative and resources like the in-depth program, which is an alternative for students who face suspension for violation of school tobacco, vaping, or nicotine use policies. There are links to support groups like Parents Against Vaping. As Luca mentioned, that might be an avenue you could try if you're trying to figure out how to help your own child. There's also downloadable PDFs for parents, schools, and teens. So we hope you find all of this information helpful. It's been a great conversation, and I thank you all for attending today's Community Connections presented by Novant Health and Wells Fargo. I found it very informative, and I want to give a special thanks to our panelists as well. Attorney General Josh Stein, Dr. Taravath, and Luca Kinard. Please remember to complete the survey at the end. The feedback is very important. And check your email for a recording of this session. I know we've gotten a lot of people asking if this is being recorded. There will be a recording so you can watch it back. You could show it to your children if you want. You could show it to educators, anybody you want. So thank you again, everybody, for joining, and I hope you have a wonderful day.
Thank you.
Thank you. Good to see you, Luca.
Good to see you too. Thank you.
Thanks.